Let's take you live now to the Health Minister making an announcement on vaccines being available to children. Have a listen.
Their border was still closed. They weren't hit by the BA1 wave, so we're not entirely comparing apples with apples there. But what is clear is that hospitalisations are almost certain to increase further from where they are today over coming weeks. The other difference, obviously, between the situation we confront today and in January is that hospitals are also grappling with flu, a range of other respiratory illnesses, and the usual surge in hospital activity that we see during winter. Our government is committed to doing everything possible to get Australia through this winter safely and healthily. Already, we have extended our support to state governments for COVID-related hospital activity, which was due to expire in September for the remainder of this year, a matter agreed between the Prime Minister, the Premiers and the Chief Ministers at their first National Cabinet meeting several weeks ago. We've also rolled out an information campaign continuing to reinforce the importance of boosters, and I and probably the CMO will have more to say about that very shortly. We've also expanded access to the fourth dose of the vaccine for over 50-year-olds on a strong recommendation from the Technical Advisory Group on Immunisation, or ATAGI, and making it available to all Australians aged over 30. And finally, but certainly not least, we've also on a Commonwealth application or submission, we've substantially expanded access to the highly effective antiviral medicines that were listed over recent months on the PBS, but up until very recently were largely sitting on shelves gathering dust rather than out in the community preventing the severe disease, which we know is just so important. And already those actions are having an effect. Just over the past 7 days, more than 550,000 Australians have received their fourth dose. The overwhelming bulk of those over the age of 50, particularly between the ages of 50 and 65, which was the new target group by ATAGI.